Core to the center's mission is the notion that health happens not just inside of the walls of hospitals and clinics and doctors' offices, but more so actually outside of the walls.
This is the first and only health justice master's degree in the country.
What's unique about this one is it's the only master's in bioethics that focuses on health justice and that centers health inequity as the biggest ethical problem of our time. Our program is a mix of people who are dual degree students who are getting their MD and planning to be physicians, and also people who are not planning to go into clinical medicine. One of our goals is to help create the next generation of clinicians and scientists and policymakers and practitioners of all kinds who are equipped to advance justice.
As students, we're not often given the tools to understand the things that we're witnessing. For my work in the emergency department, we see a lot of health disparities firsthand.
So I picked Temple mostly because I liked their connection to the North Philadelphia community. Wanted to learn more about the nitty-gritty of how community engagement actually works.
I remember working with Dr. Katz, who helped show us some of the local community, the local shops, some folks right around the hospital, which was a place that, I was typically going into work, going to the hospital, and going straight home.
Me going right from classes right to Mount Zion across the street means that I don't see them as a separate populace from me. I saw them as part of my community.
In the courses, I was given more tools, more of a vocabulary, an understanding from other disciplines that helped me think about why things were happening, how we could interrupt what was happening.
Every one of the professors and the educators are people from the real world who have had real world practice. I would learn something in class on Tuesday night and I could really take it to work on Wednesday.
With healthcare justice, with urban bioethics, it's really about understanding that relationship and that it does work both ways, and that patients project images onto us and we project images on our patients. So it's really important to address the differences in how we imagine our patients and how our patients actually are.
The students and the residents who come here are very mission driven. I found a community of people who had shared values and wanted to learn more about how to better serve patients.
Temple naturally attracts people who are here for the mission. They're here to do more good.
We're interested in radical change and transformation of the entire system to promote justice for people who have traditionally been excluded.